Hello, and welcome to my Borderpolar podcast. This is my series one called A Borderpolar Diagnosis, and this is episode three. Episode three is called. So, actually having this conversation, trying to relate to someone and explain to them about your mental health diagnosis, you need to first think about and address the stigma that goes along with mental health diagnosis. If the person you're speaking to has already heard of bipolar disorder and has already heard of borderline personality disorder, then they might already have some preconceived notions about what that means in their mind. So one of the analogies that I use as like an analogy that I use for an aid to sort of describe what a mental health diagnosis means to people is that I tell them to think about paint on a spectrum. So if you look at this graphic I have here of all the colors of red, and just imagine it stretched out even longer so you could see all the subtle differences between those lights and darks. And imagine there's just hundreds of different shades of red in there. And think about it like this. Each tiny variant, each tiny different shade of red is a symptom. Say anxiety, impulsivity, delusions, hallucinations, depression, um, uh, suicidal thoughts, whatever. Each one of those different colors is a different symptom. And when you're talking about mental health disorders, you just have all these symptoms that people could be displaying. And the doctors look at you and see which symptoms you're displaying, which colors you have. And if you have a certain grouping of colors, a certain number of colors, that a certain grouping, then they would say to you, you have a certain grouping of symptoms, you have a certain grouping of colors, so we're going to give you a category of bipolar disorder. We're going to give you a category of borderline personality disorder. But that those names, bipolar disorder, borderline personality disorder, schizoaffective disorder, schizophrenia, those names, all they are, all they are is a label for a group of symptoms that doctors can think about when they hear the term. So when they hear the term borderline personality disorder, they can think of those 9 symptoms or those 9 shades of red that qualify you for that diagnosis. Now, one of those shades of red is impulsivity, which also exists in borderline in bipolar disorder. And so you might have a shade of red in both disorders, but that's how it works. That's why there can be some overlapping and some dual diagnoses and things like that. But that's one analogy I try to think of as this paint color scheme, and how the label of the mental illness is simply a name that the doctors use to think of a grouping of symptoms so that they can decide how best to help you. The second way I'd like to try to compare living a life with a mental illness to living a life without a mental illness is to talk to people about what it's like. It's like trying to explain to someone who doesn't have children what it's like to have children. It's sort of the same thing where you can't really experience something that you haven't experienced. And so if you have children and you're trying to explain to someone who has never had a child what it's like, how big of a change it is in your life and how much different everything is, you can't really get them to grasp the day-to-day differences that impact every single thing that you do from the moment that you have a child, from how much planning goes into just getting ready to leave the house, and then how much extra you have to pack to bring with you when you leave the house, and making sure that you have everything that you need for every eventuality, making sure that when you leave the house is correctly timed with nap time and feeding times, and how everything that you knew about your life before and everything about your life now that you have a child is so much different, and it's all wrapped up in that child. It's similar to living with a mental illness, where everything you do is all wrapped up in that mental illness. Every aspect of your life is impacted by this mental illness. So when you're getting ready to go somewhere, you might have to get dressed during a panic attack, but have no choice but to continue getting dressed as you're experiencing all the physical and emotional symptoms of a panic attack. And people without a mental health disorder don't know what it's like to have to go through that. They don't understand what it means to overcome the anxiety that one might have when they have to go into a public space on their own, and how much preparation it takes to actually get to be able to do that on a bad day or even on a good day, and just all the preparation that goes along when you have anxiety or a mental health disorder. Comparing a life without children to a life with children, if you have kids and you would try to explain that to someone who doesn't have kids, you know how difficult that explanation would be to really impart to them what it feels like, how the difference is. It's the same thing trying to explain to someone without a mental illness what it feels like to have a mental illness. They have no frame of reference, but you can try your best. The second way that you might want to try to use it is if you think about some of the things that have to do, and I don't have diabetes, but in the life of a diabetic. So someone who's diabetic might have to they have to check their blood sugar. They might have to give themselves injections. They might have to take medication. They have to watch what they eat in a very different way than the rest of us do, which means they have to plan ahead for things like parties, things like outings, nights out with friends, all sorts of things. And the amount of planning that goes into someone with a severe case of diabetes, or I don't even know, even a mild case, I don't have diabetes. I don't have that frame of reference. But if you were to try to if someone with diabetes were to explain to you what their life is like compared to yours, and you don't have diabetes, it's hard to understand that frame of reference. So those are some different ways to sort of talk about these analogies to try to relate to someone on how it might be hard to explain to them what it's like living in your brain when they live in their brain. And then the next step, obviously, is to talk about the symptoms and the treatments. I went over the symptoms in depth in my last video, Understanding Borderpolar, all 9 symptoms of borderline personality disorder, and the depressive and manic symptoms of bipolar disorder. If you can go through those symptoms and highlight the ones that pertain to you, and figure out how they've impacted your life based on some of the examples I gave on how they can manifest in real life, or maybe they've manifested in your life in a different way. But if you can pinpoint the sorry, my speech gets stuck sometimes. If you can pinpoint the symptoms that you have, because not everybody has all the symptoms. If you can pinpoint the symptoms that you exhibit and how they manifest in your life, and you can relate that to your loved one, then they can better understand what kind of impact the mental health disorder has on your life. And then also you can refer them to literature, movies, and TV shows. I don't have a list of them here. There are a lot out there if you Google it. Well, it looks like I paused my recording at some point, so I'm just going to back up a little bit and go back to saying that um, the after you can use some analogies to sort of get your point across to how difficult it might be to explain to someone whose brain doesn't work differently how yours works differently. You want to get into the symptoms and treatments. And like I said, I listed all the symptoms out in my last video called Understanding Border Polar. And I'll be covering treatments in 2 videos from now. And I did touch on those in my first video. But this video isn't about exactly about telling them the specific things that impact your life. It's about having that conversation.